Every year, tens of thousands of Nigerians travel abroad, seeking to get the best treatment in what has resulted in a loss of $1 billion annually, according to medical experts. Nigeria and 4 other African Union countries met and pledged to target at least 15% of their annual budget for healthcare in 2001. Many years after, the country remains far from reaching the goal. Now, but some medical experts are in favor of domestic treatment of illnesses, insisting that good health care is available in the country. Well, joining me in the studio is Dr. Olakunle Odeyemi, Group Clinical Director, Beacon Hill Smile Group. Good morning. Thank you for joining us on TVC Breakfast. Let's even begin with a background to how we got here. You recall that in the 60s, Nigeria was seen as a mecca of sort when it comes to medical issues, especially UCH Ibadan. Talk to us how we got to this point.
Thank you very much. I actually trained in UCH Ibadan, and you are very correct. UCH Ibadan was a mecca. It was a mecca for South Africans, for West Africans, and even people from Egypt. How we got here is very intriguing because we have let ourselves go. We have not funded the medical sector enough. We have not built on the gains that we had in the 60s and the 70s. And also, the political will has not been there to improve things for the majority of Nigerians, and that's how we've got here. People travel abroad not because they feel they have money to spare, but because they're looking for good health. It's a very simple thing. And if you think you cannot get that health you're looking for where you are, you will find it somewhere else.
Absolutely.
And that is what has been happening. It's not difficult to reverse.
Really? Because I wonder, because when you look at the things or the situation on the ground, you look at the state of the health sector, you look at the quality of personnel available. A lot of persons say there are no experts or specialists, as they are being called, that we do not have them in the right numbers. And you are confident that we can still reverse this?
I am confident that we can reverse it. What I will say to you is that the top 4 nations that Nigerians go to, you're talking of America, Canada, United Kingdom, India, South Africa. You don't go anywhere in those hospitals without seeing top Nigerian doctors, top Nigerian specialists. They've gone abroad for one reason or the other. They're well trained and they're doing the jobs. So what happens is that Nigerians go over there and they end up seeing a Nigerian doctor who's a specialist in his own profession. Now, what I know is that most of these Nigerian doctors would love to come back home and do the right thing. They would love to see their people get the best of their training and basically try and improve the health care state of the nation. If the conditions are right, people will come back.
When you say conditions now, let's perhaps break that down.
Yeah. What I mean by conditions are you have good hospitals, hospitals that are well equipped, hospitals that are functioning, both administratively, both in terms of infrastructure, in terms of light, water, everything works. Now, the equipment is not the problem. Anybody can go out and buy an equipment and stick it in a room and say, I have a hospital. No, you don't. You have to have somebody who knows how to use that equipment on the right patients at the right time and get the right result. People are ready to come back. I'm an example. And I know others who have come back and are doing wonderful things. The terrain is not easy. It has not been easy for doctors and dentists to come back to Nigeria and want to start practicing. The funding is not there. Even in the private sector, which is leading the drive to come back, accessing funds has been a problem. We've had stories from the Bank of Industry and all these other banks about funding. It is difficult. Equipment is expensive, but people are doing it. I know a piece of equipment that costs 18 million naira. And what does it do? It just takes x-rays of the head and neck. It's called a cone beam CT. It costs 18 million naira. Now, how many dental practices can afford that? How many hospitals can afford a CT scan or an MRI? So funding needs to be there. If funding is there, people will come back. There are people who come back to Nigeria once a month from America. They do operations, they go back.
Yes.
They would love to stay here 3 months, 6 months, but if the conditions are not right, they have to go back.
There was an Abuja declaration where it was agreed that 15% of the budget be spent on when it comes to health. I wonder if perhaps you, the private sector and other sectors are engaging government to see that, they adhere or stick with this agreement.
It is difficult. We definitely are engaging. We've had promises from ministers of health in the past. And actually, I must say that some states, especially in the north, have increased their allocation to the health sector. Not up to 15%, but some have gone as far as 12%, but not every year, not year on year. It is easy to engage. It is the will to do it that matters. Yeah. We don't have the political power to change things. If the government decides, oh, we don't have money and we're voting 4% to healthcare sector, how do you share that 4%? The healthcare sector has primary, secondary, tertiary, and even the super tertiary. It all needs money. If the primary healthcare sector is fine, if they have problems, they refer to the secondary. If they have problems, it goes to the tertiary. That's where you need the big equipment. That's where you need the expertise. If those experts are not well paid, they won't come back. They have families to feed, they have things to do.
Absolutely.
So those are the big problems that we have. I wish the government would actually look at it and say, yes, let's devote even 10% every year, year on year.
So if we have to look at reversing this issue, talking about medical tourism, it has to begin with budgeting.
Yes.
And then what else?
It has to begin with budgeting. It has to begin with incentivizing doctors and specialists to actually stay here, first of all, and then to get people back to come and run the system. It is not every single thing that the government has to run. There are experts everywhere. They would love to come back. So if you talk to them, incentivize them, get them to do what needs to be done to improve the healthcare. Because really, if we look at it, I know about dentistry. I can tell you that probably 80% of Nigerians don't have access to dental care.
That's it.
We have just 4,000 dentists, if up to that.
The challenge for a lot of Nigerians is access to quality healthcare, because it is quite expensive, because it's now pocket-friendly healthcare services is what everyone is looking for now. Talk to us from that window. I wonder what we can do, although there is an insurance system, but not everyone seems to have access to that.
The insurance system has not helped us. It hasn't worked as well as it should have worked. And the part of the problem is how many Nigerians are employed.
Right.
To have an insurance system, you have to have something funding it. And that means you have to have an employer who says, yes, I will fund your insurance. And that's how they are funded. But if a lot of Nigerians are not being employed, they can't fund health insurance. The government has to step in. It used to be done in the Western region, where you had free medical care, free to a point, and then some basics are taken care of, and then the rest can be taken care of by the individuals or their companies and things, and the families. Funding is key. If money is thrown at healthcare and is not targeted at specifics, nothing would happen. If you build healthcare centers in villages where a youth corps doctor will not go and sit down and look at the grass all day long because there's nothing for him to work with, he will not go. So you have buildings that are overgrown. You have buildings that are non-functional. You have midwives that are trained 1 or 2 weeks, they've done it, and they're doing their jobs there, the traditional midwives. So the whole system needs to be revamped from top to bottom. If that is done, access, yes, is expensive.
Right.
Medical care is expensive. The equipment is expensive. If we say we want to go into the 22nd century or 21st century, as we say, there's a lot of digital equipment that are around. They're expensive. If we don't have proper light, motherboards in this equipment will burn. With one NEPA surge, it's gone. You have to replace it. We don't produce these things in Nigeria. We don't make them. Therefore, you buy a big machine, you have to get somebody from abroad, or you get the company to come in, you fly them in, they have to repair it. Those things are what costs money.
Right.
So it's not easy. We don't have a developed drug manufacturing sector that can supply these things at a cheaper price, we import drugs from India.
Right, yes.
So those things make it expensive. But at the same time, the government can meet the poorest people at their point of need. There should be no problems doing that. And if you take care of the primary healthcare sector and people don't get bigger problems, then it's less expensive.
All right. Dr. Olakunle Odeyemi, we have to leave the conversation here now and still keep hope alive that we will be able to reverse the medical tourism that we've been speaking about.
Thank you for your time. Thanks for having me.